Well, after poor medical care provided to her father and others in regional New South Wales, ABC journalist Jamelle Wells has been closely following this week's New South Wales parliamentary inquiry into health outcomes and access to health and hospital services in rural, regional and remote New South Wales.
Jamelle Wells joined us earlier in the studio to explain her family's experience with the health system and what the inquiry has heard.
2019, my father, Alan Wells, who was born and bred in Cobar in outback New South Wales, fell and broke his hip and was flown to Dubbo Base Hospital for surgery to repair that. And while he was there, Joe, he had 2 surgeries within 5 days. He was denied food and water for 3 days over a long weekend because the hospital said they couldn't afford to pay someone to come in and do a SIP test on him to assess his ability to swallow. He went without pain relief on one occasion because the hospital said they'd run out of morphine and Panadol. They had the wrong doctor's name on his medical records. They charged our grieving family $600 for the medical records, and in those records were the records of another patient from another town, and they were just some of the aspects of his care that our family was very distressed by. He was discharged very suddenly in 40-degree heat by road ambulance back to Cobar, where that hospital discharged him even though it was empty, and he died a few days later. And through listening in as a grieving family member to this inquiry, we've discovered that we're not alone. The inquiry has more than 700 submissions, and a lot of the families who've given evidence have provided evidence similar to ours.
It's utterly devastating for your family, but sadly you're not alone either. You just mentioned there has been allegations of litanies of failures throughout regional health services in New South Wales. What more has the inquiry uncovered? We know it had its 4th sitting in Wellington this week.
That's right, and it has uncovered versions from both sides, from grieving families and patients, and very brave doctors and nurses, the frontline staff who are dealing with the health system on a day-to-day basis have given compelling evidence. We've heard, for example, that a man was denied pain relief at Narromine Hospital. He was dying of cancer, and his daughter said he died an agonising death because he only saw a virtual doctor. GPs and nurses have given evidence that they're without crucial blood supplies, that they've had basic equipment taken away from their hospitals so they can't actually even stitch up wounds. And they've all painted a picture of a system that is it's a broken system. And one representative from an outback council, Bourke Council, told the inquiry that they have a beautiful new hospital, but she said bricks and mortar don't save lives. What is coming through from the inquiry is that there are a lot of these beautiful hospitals, but nothing is being done in them. That a lot of the services are being centralised, and people in little country towns are being left without basic things like being able to get a cut stitched up, or one nurse said that her hospital had run out of antibiotics. So very basic things like that. And one witness told the inquiry last week that after the drought and bushfires, people in regional towns are feeling a little beaten down, and that they're feeling that they're not actually worthy of face-to-face medical care. And that was on the basis of evidence about virtual doctors and telehealth. And the inquiry's heard that, well, some of that's great. For some basic face-to-face things, it's just not working for a lot of the witnesses who've given evidence.
Jamelle, this might seem like a bit of a silly question, but as a grieving family member, and for your family as well, has this shocked you? I mean, can you believe that this sort of a thing in Australia is happening not just to you but to other families as well?
It has been a shock. I have been overwhelmed by some of it, and knowing that the more than 700 submissions to the inquiry have had a lot of similar experiences to ours, in a way it makes our family feel not so alone in speaking up, but it's horrible to think that people in country towns are dying younger than their city counterparts, and all the statistics show that. And a lot of them are dying from very basic things that they could seek treatment for. One community member from an outback hospital said that she has a lot of elderly people in her town, and she said they don't seek basic cancer treatment, they don't follow up with specialists and GPs because they're scared. They're scared of speaking out about what they're not getting, and she said the travel is just too much for them. They're not prepared to travel 4 or 5 hours to Dubbo or on to Sydney because they're people in their 70s, their 80s. So that's quite disturbing. And there's been a phrase given to this, death by postcode, by a lot of media outlets. And actually sitting in on the inquiry as a family member, I can see where that's come from, and I can see what they mean.
So, and there's so many issues here. Access to healthcare. A lot of these people that you're saying in these remote communities, particularly Indigenous communities as well, leave it to the last moment until they are so sick. It's very hard for them to lead a quality of life after that. What do you see as at the heart of these problems? Is it funding? Is it lack of will? Is it the fact that there's not enough incentive for clinicians to go to regional and rural towns, not enough wraparound infrastructure services? What do you think it is?
All of those issues have been mentioned by witnesses at the inquiry, and whilst funding has been an issue, what a lot of the doctors have said, it's more a case of basic services being taken away from regional hospitals. We heard at the inquiry in Cobar, for instance, that people present to the local hospital there and they can't get basic things done on some occasions, but the Area Health Service said we have a great triage system in place. We triage people and then they're sent to the appropriate hospital where they can get that care. But it was then raised that sometimes that delay can be 4 or 5 hours, and it was raised at that particular hearing day that a man actually had his toes amputated because of a delay and because he'd been sent to different hospitals. So I don't think there's one solution. It's not up to me to make that call, but the suggestion from the professionals speaking at the inquiry is that they want a more hands-on approach. They want more staff that they can learn from and that can mentor them. A lot of the nurses have given evidence that they don't have senior nurses they can learn from, and one GP gave evidence. He was from Narromine, and he said that all the other doctors resigned from the hospital, so he didn't stay there because he was worried that he would be working around the clock and that he would actually start making mistakes. So he said whilst that was very hard, he had to just step away from that role.
That's Jamelle Wells speaking with us a little earlier.